Okay, so today I'll be presenting on how virtual reality is transforming health informatics, particularly in patient care, training, and safety. I'll talk about how this technology works, its benefits, ethical considerations, and how it can be integrated into healthcare workflows. Health informatics is the field that deals with collecting and managing patient data. It uses computer and health systems. This data helps healthcare professionals make better decisions and provide safer, more effective care. Technology like virtual reality, augmented reality, and telemedicine are some examples of tools used in health informatics. I'm going to focus on virtual reality, or VR, and how it enhances patient care and provider training. Virtual reality is a 3D computer-generated environment. It's designed to replicate real-world experiences. In healthcare, VR is used to train providers, educate patients, and reduce anxiety during procedures. For example, patients can experience a VR simulation of the anesthesia process before surgery. This helps reduce their stress and improve their understanding of the procedure. VR is also used to train CRNAs. Through VR simulations, providers can practice airway management, nerve blocks, and neuraxial blocks in a safe, controlled environment. These simulations improve communication skills and reduce the need for continuous supervision. This all helps lower training costs and allows students to practice basic clinical tasks repeatedly until they become more proficient and confident. The FDA recognizes VR as a medical device. But because it's an emerging technology, researchers are still studying its long-term effects. Challenges include frequent software updates and the difficulty of creating a placebo for controlled studies. To combat this, post-market surveillance helps track safety. It ensures VR continues to benefit patients as technology advances. There are important ethical and legal concerns. VR can be used to improve informed consent by showing patients what will happen during procedures. However, providers must ensure that consent is truly informed. Another topic is justice, which is another concern. Not all facilities may have access to VR, so it brings up the issue about equitable healthcare. VR must also comply with data protection laws such as HIPAA, and to avoid legal liability. Patient safety is always the top priority. VR allows trainees to practice simulations that build communication, empathy, and clinical skills. By repeating these scenarios, trainees become more confident and competent, which will improve patient outcomes. Assisted VR informed consent also reduces patient anxiety before procedures, making care safer and more effective. Interestingly, VR can reduce the need for sedatives like propofol or midazolam during procedures. Lower doses decrease the risk of side effects such as oversedation or delayed recovery. It does this by helping the patient relax without relying on medication, which can reduce post-op complications. In addition, VR helps manage pain. Studies show that most patients, including those undergoing cardiac surgery, report lower pain levels after VR sessions. VR does collect sensitive personal and biometric data, which will create a potential privacy risk. This could happen from weaknesses in software or hardware, which could allow cyber attacks that manipulate patient data or virtual scenarios, potentially affecting clinical decisions. Healthcare providers must have safety measures in place to kind of prevent this. A typical VR workflow for anesthesia training includes 3 stages. It's preparation, simulation, and self-assessment. Trainees put on the VR headset and enter a simulated operating room with physical tools like a mannequin and a laryngoscope. They perform procedures while the system tracks their actions and provides realistic responses. Afterward, the trainees receive feedback, reflect on mistakes, and repeat the simulation to improve their skills. Some examples of this is CAE Vimidex and Oxford medical simulation. This structured workflow improves patient safety by allowing trainees to practice high-risk procedures in a safe environment. It builds proficiency, enhances decision making, and provides providers for real-life emergencies. VR can even simulate complex scenarios such as equipment failures or OR crisis, helps trainees respond more effectively. So what does this mean for anesthesia? VR can be integrated into training programs to ensure all students receive consistent, high-quality learning experiences. It provides a safe space to practice before working with real patients, and exposes learners to complex scenarios they might rarely see in the clinic. A platform like Simvana is already being used at institutions like University of Alabama and the University of Southern Mississippi. Its simulation library also includes tasks such as machine check, ET intubations, RSIs, and troubleshooting the equipment. Research comparing VR to traditional hands-on clinical learning shows that VR can produce higher learning outcomes in certain scenarios, like managing a hypotensive patient during surgery. This just shows that VR training is effective and it should be considered for training purposes. In conclusion, virtual reality is a powerful tool in health informatics. It improves patient safety, reduces reliance on sedatives, and enhances training and understanding. But keep in mind, ethical and security considerations must be carefully managed. Despite the benefits, there are still going to be some challenges. Ethical concerns include informed consent and equitable access. There's also the risk of security and privacy. Additionally, VR requires significant investment, frequent software updates, and trained staff, which can all be barriers for smaller healthcare facilities. But when used responsibly, VR has the potential to benefit both healthcare providers and patients, making care safer, more effective, and more accessible. So these are my references, and that is it.